Good evening, everyone, and welcome. We're going to be talking about type 1 diabetes and all different things. This information comes from Dr. Jocker's article on type 1 diabetes, the symptoms, the risk factors, and the support strategies that you can utilize. If you have any questions, please feel free to give Dr. Justine a quick text. I wanted to welcome Dr. Justine with us here this evening. She is our leader here at Justine Blainey Wellness Center, and her main objective is really to help you get the best care so that you can be the very best version of yourself. And she genuinely believes that everyone deserves a healthcare team. Not only focuses on prevention, but optimal health and open communication. Please help me welcome Dr. Justine.
Hello, everyone. This is going to be amazing information about diabetes from Dr. Jocker's article. We are also going to cover 12 natural solutions that he recommends. Coming up, we have another talk about diabetes and how it's related to your nervous system and stress. We have information about band exercises to strengthen your ankles and to strengthen your shoulders, coming up with our co-op students, Jasmine and Jordan, who are both off on their way to chiropractic college, and we're excited for them. We have information about autophagy. Dr. Udani will be leading that about anti-aging, so stay tuned with us. We have a new topic every single week, and we're excited to be able to learn one new thing each week. So as we talk about type 1 diabetes, again, we're using Dr. Jocker's article, symptom, causes, and 12 support strategies. So what is type 1 diabetes? It is an autoimmune disease. It's different, and then type 2 typically affects 5 to 10% of patients, and it means that we do not handle sugar well. We do not handle glucose well, and for majority of people, they need insulin. There are a very few select group who can really do the work. I mean, it's a lot of work and a lot of monitoring if you don't use insulin. So you want to be super, super careful and monitored with that. But the majority of people will use a medication, use insulin to help them. So we're going to be going over some risk factors, some diagnosis, some conventional treatments, root causes, and some natural solutions from Dr. Jocker's. So what's the difference? When you look at type 1 diabetes, it's typically starts in children, and unfortunately there's more and more of it. So we've got to ask ourselves why. They're not sure why at this time, but certainly stress plays a big role. And when the body is not producing the insulin it needs, so typically the majority of people need insulin, and the symptoms start suddenly and they're horrible. When you have type 2 diabetes, typically later in life, symptoms are gradual, so people are not sure what's happening. It is rising exponentially, more and more people with diabetes, and they know that it's related to healthy or unhealthy diet, lifestyle, physical activity, body weight, smoking, tobacco use. So we know that environmental, and this is something that we can help control. Look at the factors that we can change in our lifestyles. We are producing too little insulin. The risk factors are age, obesity, poor diet, family history, inactivity, and it also can be related to ethnicity. The majority of time, the conventional route is medication, but there are certainly, as a chiropractor, Dr. Jockers, we talk about controlling what you can control, which is your lifestyle. So we're going to have a lot of great information for you today. As we look at that type 1 diabetes, we know that you look on the left-hand side, you'll see the healthy functioning pancreas. It's using insulin like a key to get the glucose into the cells. But somebody with diabetes, that key is no longer working, so the cells cannot use the glucose properly. Some of the symptoms that we're going to see is we're going to be looking at frequent urination. So be careful with this because there's no pain with frequent urination. Just going often, very thirsty or very hungry, nauseated, troubles with vision, fatigue, irritability, weight loss. So sometimes people say, well, I'm on this, weight loss regimen, but you're losing it more quickly than maybe you should. And often getting sick. And we're seeing more and more people get sick more often. So we have to be able to make sure we're doing the proper testing for diabetes. Some of the pathogenesis of it is that insulin is absolutely necessary for our bodies to get sugar right into our cells and to help us have that energy. So we need to make sure our pancreas is creating enough insulin so that we can manage those sugars. So if we look at how the body controls these sugar levels, you will see that the sugar is, foods converted to sugar, and that insulin helps open the door so that our cells can be able to use that proper energy. When we look at the types of insulin, when we look at type 1, we're not able to process that glucose. And if it's untreated, it can become very, very serious and lead to severe long-term health issues and autoimmune destruction. So basically destroying not only pancreas, but other cells in the body. When we look at type 2 diabetes, unfortunately, this is way more common. We're developing insulin resistance, meaning the body's not able to use it properly, and we're reducing the amount of insulin in our body. There are different classifications for diabetes, and most people know now. We've gone over type 1, type 2. Type 1 is more autoimmune, type 2 is more metabolic dysfunction. We will be covering lots of information about metabolic dysfunction at our makeover. Again, type 2 is typically into adulthood, and it can affect your immune system significantly. The one that most people aren't as comfortable or know more about is type 3 diabetes, which is related to Alzheimer's, dementia, and memory. We know that these stressors and the way our body and blood-brain barrier is affecting how the sugars get to our brain. And finally, gestational related to pregnancy. When we look at the stages diabetes in type 1, you'll see at the very beginning they think about a genetic risk, but we have the stages where first it starts to affect your immune system, and then stage 1, stage 2, stage 3. And unfortunately, the diagnosis doesn't often come till much later. You can see the symptoms at the top are often ignored or thought of as not being a big deal. I go to the bathroom often. I'm somebody who can't make it an hour car ride. I have to plan my stops. I'm always thirsty. These are things that we still want to be aware of. Some of the risk factors for diabetes type 1: age, family history, ethnicity, often more common in Hispanic, Latino, African Americans. And it is affected, but they're not sure why, related to environmental factors. They do see it more common in the colder climates. That's kind of challenging as Canadians, but we want to be aware of these symptoms that are not pain so that we can be making sure we're getting regular testing. We always say test, don't guess. So regular testing for your blood work, your glucose levels that we're going to cover, of course, of your nervous system. Some of the environmental risk factors you will see, we have prenatal. So even before you're born, as Dr. Jocker talked about, even C-sections, rubella, low intake of vegetables in diet, so higher birth weight. So there are factors even before you're born. As we're born, then it's looking at exposure to cereals, high sugars, cow's milk, eggs early on, root vegetables. So increased weight gain. And I know, when babies are born, they lose 10%. So it's like they got to get fat fast. And they're trying to say, hey, no, you need the formula. But breast milk is best, and definitely in my opinion. And we want that natural source. And we don't need to get our kids fat fast. We don't need to be making sure we're monitoring that they're growing quickly. As long as they're growing, that's what matters. Not that they're growing quickly, because that can increase their risks. Weight gain earlier if you can go back, Angela, weight gain will promote that progression, especially early weight gain prior to puberty, steroid treatments, psychological stress. And we've seen a ton of that with COVID, with staying home long periods, with increased use on computers and social media. the comparing game, keeping up with the Joneses or keeping up with our friends. So many of these emotional stresses affect metabolic disease, affect our cytokine storm. So these stressors need to be addressed in early ages. And then we get into our risk signs with vitamin D and essential oils. This is particularly common in North American diet. So unfortunately, these risk factors are severe. The symptoms of diabetes type 1 can be very severe if not addressed quickly, but there's many causes. When we look at some of the testing for type 1 diabetes, there's a lot of blood work testing, looking at insulin levels that can be done with your medical doctor or with your naturopath. Some of the conventional treatments, of course, is prescribed insulin. I do know of, some kids who are significantly monitored, very strict diets, still monitoring their glucose levels, that with type 1 can not use metformin because metformin does have risk signs. But I definitely recommend that you have to understand this is very difficult, and that's why majority of people use insulin. And I do think everybody, if they're in type 1, needs to make sure they have regular monitoring of their levels. So this is something you do want to be making sure you're reviewing with your medical doctor and or your naturopath. Some of the root causes we reviewed. They do have, according to Dr. Jockers, it makes a difference right early on. And a lot of times we're not aware of that. Like, we're quick to give formula or cow's milk, and that leads to gluten intolerances, gluten allergies, and they're unsure why. Making sure they get enough vitamin D, and definitely breast milk is best, because if we have chronic early infections, that can make a difference. They're looking at how vaccines play a role to this. There's not a lot of understanding, but certainly make sure that you're aware that you can spread out your vaccines. We do not need to do them all at once. You can make sure that you can monitor if there's any side effects along the way, or any risk signs along the way, even small or big. And you can delay. So in different countries, they may delay. There are different exemptions, whether they're for health reasons or religious reasons, but be aware that you can make informed choices as you discuss this with your medical doctor. So taking a look at also different types of chemicals. I know since COVID, there's so many toxins and Lysol and different toxins that we're trying to clean our homes with, but it actually can be toxic. And that's why we do a lot of information on detox and natural cleaners, natural soaps, natural personal care hygienes, natural dishwasher soaps, natural laundry detergents, because these chemicals, the problem is they're not monitored and they do build up and can increase your risk. We have to also look at some of the root causes of celiac, or less obvious is gut infections or gut instability. Definitely celiac and type 1 diabetes are related. Gut health is related. And they're often looking at these early developments of adding different foods to our children and our infants, especially different types of milk formulas. So making sure you are aware that you can create your own formula if you have young children or young infants, and being very careful as we introduce those first foods. It just kills me when I see like pop in a baby bottle, right? So one of my passions is breastfeeding, and love to volunteer with breastfeeding moms. The longer, the better for mom, better for the baby, and make sure that we really understand that this does play a huge role these first development years for our children later on in life. Next, we also have to look at family history. There's still, again, not a lot of understanding, and also the history and gut health of the mom early on. Number two, like I said, the breastfeeding plays a big risk, especially if it's less than 4 months. The great news is now moms can get, and we can also get parental leave. So dads can get, or partners can get extra time off. And the more or the longer we can increase that breast milk, the better and the less risks. You can see there's a ton of benefits to breast milk for the immune system, protecting against pathogenic infections, but also improving that gut health, that microbiome in the baby. So definitely, even as you're introducing foods, even if it's once a day, later on, 9 months towards 2 years, the national standard, international standard is 2 years of breastfeeding, not 6 months. So if you can get the support you need around you, highly recommend it, because this will help not only with diabetes, but with all areas of the immune system. I do know it's challenging. I breastfed for 4.5 years, so it is hard. I am grateful for my husband and his support. So also making sure you get the support system from family and friends around you, because you can get that nipple confusion, and confusion among food to breast. Pumping can be challenging, so making sure you have that help, and certainly something I'm happy to help you with if you have questions. Next is gluten and casein allergies or intolerances. They know that early exposure can affect these intolerances. So, milk, or sometimes you see HOMO or 3% early on for children, knowing that it might seem fine at the time, but could be leading to challenges later. This is something that is not well understood, but they know that there's some kind of relationship. So again, being very cautious in those early years, because these intolerances can build up over time. As we look at number 4, chronic infections. And so some of this relates to vitamin D deficiency, even in young children, because they aren't getting enough of that sun. So there's lots of natural ways that you can get vitamin D into the body. Definitely getting some time outside, even in the winter, or especially in the winter. But typically in the winter, we do need some supplemental support. I know personally I'm not out in the sun for at least an hour with 75% of my skin exposed. I don't live in the warm countries, so making sure you have your vitamin D levels tested. They know that certain viruses can be related with increased risk of diabetes. We know that enterovirus, so gut viruses, again, can affect our body's ability to manage insulin. So normally we have an innate intelligence that's going to be able to help with managing these enteroviruses. But if we have low gut health and microbiome in our gut health that isn't adapting, then we're more likely to have challenges and lead to type 1 diabetes. Number 5 is, and something that they're looking more into, how this is related, as Jocker points out, that there's lots of different chemicals in these. So they're looking at figuring this out. And again, you have the ability to spread out your choices instead of doing, MMR, DPT all at once. You can spread them out. You do have to ask in advance for that to make sure your baby's body has a chance to adapt. And also you are able to delay. This is something that you would discuss with your medical doctor. Vitamin D deficiency, this does need to be tested. It's happening more and more that children and adults are vitamin D deficient. So we do have vitamin D gummies at the office. We do have different types of vitamin D drops in order to be able to help to make sure you are getting enough, anywhere between 2,000 and 5,000 through the winters. For someone like myself who's very fair-skinned, might need more. We do need to look at toxic compounds, and these toxins can be in arsenic, pesticides, organic pollutants, bisphosphonates A, phthalates. So a lot of phthalates are in your home care routines, like your creams that you might put on your body, your shampoos, your conditioners, your cleaners, your toothpaste, some of these chemicals, your detergents. So then you're wearing it on your skin, which is the largest organ in your body. So definitely looking at how, maybe each time you go shopping, reading the ingredients. So each week you're trying to change one chemical in your home, and then being very aware that these off gas. So if you do have, say, for example, unhealthy cleaners, maybe you have Clorox or you have bleach, something like that, Lysol. Keep it away in an area in your home where people do not go, because these are off gassing and you're breathing them in, being unaware of these toxins. So we're going to go into some natural root solutions. We've got 12 solutions. Number 7 is some of the chemicals they found in infant, as in some of their umbilical cords. So they've done research in the umbilical cords to find that infants before birth, like fetuses, are already toxic. So this is why we're talking about making sure the home is healthy. So that helps mom, which helps the babies, which helps the infants, and then helps the toddlers as they grow up. So they have less risks of toxins and reducing the risk of diabetes and other areas of infection. As we look at these natural solutions, monitoring our blood glucose is the best. Monitoring our diet, our sugars, and if we are going to have higher sugars, higher sugar fruits like bananas, that we're aiming to have those earlier in the day. Number 2 is looking at an anti-inflammatory diet, being aware that gluten, so white bread, fried foods, fries, hamburgers, processed foods, chemicals, or different over-the-counter salad dressings, corn syrups, sunflower oils, vegetable oils. All of those are pro-inflammation, increase inflammation in your body, working versus looking towards grass-fed, free-range, wild meat, healthy fats like avocado or avocado oils, lots of fresh vegetables and fresh fruits, organic where you can or where there isn't a good peel. Looking towards making sure that you have really great spices or herbs to reduce inflammation, like organic basil, which I grow in my garden, oregano, thyme, rosemary, sage, are all spices that you can grow yourself in the summer, or you can buy and to add to your foods. Looking towards adding fermented foods. I'm not very good at this, so you may want to talk to look towards diets and recipes for this to slowly introduce it. Kefir, looking at extra virgin olive oils, adding ginger, for example, ginger and turmeric shots, or tea, in order to reduce inflammation. We want to be able to test for food sensitivities. This is a difficult one. I'm allergic to a ton of things, not as severe now since I've done a lot of SKIO technique to reduce allergens and sensitivities, but I did grow up feeling like I was allergic to everything from eggs to milk to gluten to sugar, chocolate. I was allergic to it, lamb. So you can have food allergies that can be extremely severe, meaning it's going to affect your breathing, it's going to affect swelling, and you have a very severe, deadly reaction very quickly. But when you have food sensitivities, they can build up on itself. So you don't notice it when you first eat it, but then when you eat it more often or you're exposed to those more frequently, then the reaction gets more and more severe. And it can affect joint pains, achiness, bowel things like IBS, tiredness. For me, definitely, I'll get rashes, eczema. It'll travel up my arms, behind my knees, into my face, behind my hair. Can affect headaches, weight gain. The most common are wheat and gluten, milk, dairy, eggs, corn, and sugar. So those are the most common. They say that it can affect upwards to over 40%. So one of the best ways to test for this is with your naturopath, is with the SKIO technique, so doing biofeedback. Also doing a elimination diet. So that means you eliminate, say, anything with corn syrup, or milk or dairy. You eliminate it for 2 weeks, and then you have a day of a ton of it. And then you determine how your body reacts over the next 3 days. So to give you an example, that is, people often will go say they think they're healthy for an egg McMuffin. And often maybe the egg is good, but it's probably not organic and free range. But for me, if I have the McMuffin part, the bread part, it has corn on it, and I get a rash immediately. My skin changes immediately. My breathing changes immediately. It can bring on asthma-like symptoms, affect my ability to exercise, and that happens over the next 2 to 3 days. I do not notice it like immediately. So to be super careful and to monitor these changes and know that it's something that can be layered, and you don't feel it just with one time, but you can feel it over time. Next, we can look at improving our sleep affects our overall stress in our body. So we have numerous talks on sleep and your environment, your pillows, the temperature, your sheets, your blankets. But very, very important trying to go to bed at the same time and get up at the same time. Going to bed before midnight makes a massive difference, and getting away from technology and blue light before bed. Number 5 is exercise. Of course, we need to move, preferably not right before bed. I know I have a challenge when I play hockey late at night. It's hard to get to sleep right away. So reducing those stressors and getting the exercise you need is right. Trying to do it in the morning or at lunchtime. When you look at improving your sleep afterwards, you can use things like lavender oil and different calming oils, essential oils, different types of lavender lamps, meditation apps. Definitely looking if you're having coffee or caffeine earlier in the day, trying to get sun out time or some sun exposure each day. The exercise, they know that exercises will improve our ability to deal with sugars. They know that you want to make sure that you're checking your blood sugars before you exercise, getting enough water with your exercise, and that it's definitely going to help your body deal with digestion, oxygen, stress, and mood, and it's going to help your overall body be able to reduce stress. If you need different exercise programs, let us know. We'd be able to help you create a stretching program. On our website, we already have the 50 stretches for turning 50. It does take about 15 minutes to go through a full body stretching routine. So if you can't do anything outside, you think it's just freezing outside, or you have different limitations, those are stretches you can do inside. We also have full body stretch routines, core exercises, balance exercises on our website. But key is to move. Even if it's a sit and fit, some form of movement daily. Those counting your steps, if you have that kind of watch, getting that 10,000 steps or 20,000 steps is amazing to help your overall digestion, your gut health, your body deal with stress, which is going to reduce your risk of diabetes. Of course, checking, like we said earlier, your vitamin D levels, and checking that at least annually with your medical doctor or with your naturopath. Looking at probiotics and prebiotics as the foods that you can eat, as well as supplements. If you're looking at supplements, definitely talk to your naturopath to make sure you get the right one. It definitely can help your overall gut health, your absorption of materials. Some of the foods, though, that you can do easily, think of 1 or 2 in this list that you can add. Things like garlic more often, onions, leeks, asparagus, Jerusalem, artichokes, jicama, chicory root, dandelion greens. There are many more fermented foods like sauerkraut, kimchi, coconut, kefir, kombucha that are going to help your microbiome, which is going to help with absorption. So definitely get some advice on some of the supplements, and then try to add some of these healthy foods. Number 8 is getting your essential oils, avocados, healthy nuts. You can see the chia seeds. Looking towards adding things like macadamia nuts, walnuts to add to getting those healthy foods, flax seeds, but also adding omega-3 supplement. I put that out every week for every day for my husband. That's going to help overall digestion, help your joints. And even it helps with brain fog. Eight was the essential oils. Number 9 is looking at magnesium and zinc levels. Again, test, don't guess. Talk to your naturopath. Look towards grass-fed, pasture-raised or free-range chickens and eggs and wild-caught fish, nuts, and seeds. Things that you can add to help with zinc are oysters, chicken, cashews, watermelon seeds, almonds, salmon, spinach, asparagus. So these are all things, dark chocolate, cacao. So things that we can add. And we know that when we add magnesium, that helps your muscles, helps your body relax. So that's going to reduce stress overall. And zinc can also help with your immune system and digestion. Number 10, looking at reverserol. I did use this, and my mom was using this as she was dealing with her cancer journey and beating cancer without chemotherapy or radiation. However, please don't guess, don't self-medicate, even with a natural supplement. Make sure that you are getting some advice with your naturopath or a holistic nutritionist, so that you have the right amount for you, and it's not going to be too much with any other supplements that you're using. It does help with reducing overall inflammation. It can be found in some of your foods. Just because it says red wine, that doesn't mean a ton or a bottle, but they have shown that a glass a day can be supportive. So adding those to your body can reduce inflammation, support circulation, improve skin and eye health, help your immune system, improve your overall energy, and even help with brain fog. So there's lots of great research, even recent research on reverserol. But again, please do your due diligence and talk to a naturopath first. Number 11 is using alpha-lipoic acid. These are, again, lipoic acid getting supplements to help. They have shown that it can help with diabetes, but please, you to know your right dosage. Talk to a specialist to make sure, and we don't just add supplements and stop any medications. You want to make sure you're talking to your medical doctor or naturopath and doing this in a safe way, because the symptoms of type 1 diabetes can be very severe, and it does require quite a bit of work. Some of the ways, though, that you can get lipoic acid naturally: liver, kidney, heart, broccoli, sprouts, cauliflower, eggs, and onions. These are some of the foods that you can add naturally with reduced risk to help your overall body to increase these levels. There is tons and tons of help with diabetes. Again, it is very serious. You most likely need with type 1 to manage insulin daily, and the support of your medical doctor and your naturopath. Working with a naturopath can help you manage it much more easily. So definitely recommend having a consultation, and she does do meet and greets complimentary, whether in person or naturally. Now, the 12th one is chiropractic. Chiropractic helps your nervous system and reduces stress on your body. And when you reduce stress on your body and how your brain can connect to all parts of your body, every single organ, from your heart to your lungs to your pancreas to your digestion, helping with vagal tone, your vagus nerve that travels all the way down to your digestion, is going to reduce stress on your body. So anybody with reduced stress is going to be overall healthy. You know that if you're stressed out, you're more prone to having brain fog, digestive concerns, lowered immune system, and much, much more. So I do recommend everybody have a spinal checkup on a regular basis. If you have a spine, it deserves a spinal checkup with the highest level of technology. So we went through a ton of information on diabetes, type 1, type 2. Get your checkups, monitor your levels, and do what you can to add those natural foods. We have more coming on diabetes and your nervous system, and then followed up on great exercise as with bands with our co-op students, Jasmine and Jordan, who are future kinesiologists and future chiropractors. And then followed up, Dr. Udani has information on anti-aging. So stay tuned with us. Great information every single week. We look forward to seeing you each week and learning one new thing, one new food from today. Maybe you're adding leeks. Maybe you're adding artichokes more often. Maybe you're adding sage or rosemary. Think of one new thing every single week, and you can be your best. So stay tuned, connect with us. Please do a review. We appreciate you, and we'll see you soon.